Lumbar stenosis is a condition where the normal dimension of the lumbar spinal canal becomes significantly narrowed. The lumbar spine is a mobile segment, and over a lifetime of movement, the joints in the lumbar spine can begin to wear down and become incompetent. When this happens, the body makes an attempt to stabilize this process by thickening the ligament between the vertebrae, and also by making the joints themselves larger. Eventually, the ligament becomes so thick it buckles inward towards the spinal canal. As for the joints, they begin to grow into the spinal canal in an area called the subarticular recess. This is also where the takeoff of individual nerve roots live, resulting in nerve root compression. This is a cross-sectional MRI of a lumbar spine without significant stenosis. The important part to look at is right in the center. We see a white circle with little gray or black dots in it. The white is spinal fluid and the gray dots are the nerve roots cut in cross-section. We know the nerve roots are well decompressed because they are surrounded by fluid. If there was significant compression, this fluid would be shifted away from this level and you wouldn't see the outline of the nerve roots. Here is an image of someone with severe lumbar stenosis. Notice the absence of white fluid. The nerves are so compressed by ligament and bone, no spinal fluid exists at this level. When we stand, this compression becomes even more severe. When we move our legs, the nerve roots are pulled across these bony and ligamentous overgrowths, and they begin to cause pain and other symptoms. Lumbar stenosis can present with fairly classic symptoms. It can be a sharp or burning pain associated with standing and walking, frequently getting better with rest, sitting, or bending over. This makes sense anatomically. When we stand erect, our spinal canal narrows slightly. When stenosis is present, this additional narrowing can be enough to create symptoms. When we sit or bend over, our spinal canal opens a little, decreasing the degree of nerve root compression. The prognosis of lumbar stenosis is good in the sense that it is not a life-threatening condition. However, it can be a significant cause of decreased quality of life due to the pain that it causes. I advise my patients that it rarely, if ever, is a cause for paralysis unless accompanied by another pathology or trauma. Typically, lumbar stenosis leads to a progressively worsening buttock or leg pain. Surgery is advised when symptoms are persistent or worsening and not responding to more conservative measures.